I am Dr. Nagarjuna Maturu. I head the Department of Pulmonary Medicine at Yashoda Hospital, High-Tech City, Hyderabad. So November is a month which is celebrated as a COPD awareness month every year. So what is COPD? COPD is a problem which affects the lungs and which is caused by smoking, exposure to pollution, or taking in irritants or toxins over a long period of time. COPD is a very common problem in our country, and in fact India is said to be the COPD capital of the world, which means that the highest number of people living with COPD are in our country. So it is high time that we're all aware of COPD and what needs to be done. And this year the theme for the World COPD Day is Know Your Lung Function. So this is what I'll be talking about in the next couple of minutes. So lung function, how do we test lung function? There are several ways, several devices which can help us assess our lung function, and this is called as pulmonary function testing. So the most basic of these devices is called as a spirometry, which is available in almost every hospital in our country and which is easily accessible and can easily be done. In addition to the basic spirometry, you also have several other machines which give more in-depth analysis of the ways the lung function, and some of these include lung volume assessment by what we call as body box, something called as DLCO that assesses the lung diffusion capacity, and machines called as oscillometry which are more sensitive than the spirometry in picking up airway obstruction. There are a lot of machines to assess our lung function, and the most basic of them is the spirometry. So why is lung function important in COPD? So there are three reasons why it is important. First is to diagnose. So the diagnosis of COPD is based upon finding a change in the spirometer. So this is why it is very important. You can diagnose your problem by knowing your lung function. Second is to prognosticate, which means how bad your problem is. So when you do your lung function, you also know how severe the problem is, and you also can estimate how long you will be healthy, what needs to be done, and what treatment needs to be given. So it is called as prognostication. Third is monitoring. So over a period of time, with treatment or without treatment, if you do serial lung function testing, you can know whether your lung function is improving or whether your lung function is worsening. So this lung function testing or PFTs will help in diagnosis, prognosis, and treatment monitoring. With this, I will briefly touch about the newer lung function tests which are available. As I have said, spirometer is the basic thing. Spirometry is what needs to be done, definitely, no doubt about it. Everybody have to get a spirometer, and spirometry is what will define COPD. So on spirometer, if you get obstruction, which means the ratio called as FE1 by FEC, if it is below 0.7 or if it is below the lower limit of what is expected at your particular age and gender, then you will diagnose the person as having an obstructive disease or COPD. But what is the problem with spirometer? That it is not a very sensitive tool. In early disease, a spirometer may not show abnormality, though the disease will be there. So how do you pick up an early disease? How do you define early COPD? So that is where the newer lung functions will help us. So there are three things. First is the body box. Body box plethysmography is a test which is the gold standard for calculating the lung volume of a person. So in many cases the spirometer can be normal, but the body box will give a value called as RV by TLC. If this is elevated, it means that there is some problem happening in the small airways. There is a small airway defect, and that is an early sign of disease. Second is DLCO. So this is also a test which will look at the ability of lung to diffuse gases, to send in oxygen, remove carbon dioxide, so on and so forth. So in early disease, in emphysema for example, which is a type of COPD, the first change which happens is not change in spirometer but a decrease in DLCO. So a DLCO is also a more sensitive tool than spirometer to pick up your lung defects. Third is what we call as oscillometry. Again, this is there in several centers. It is better than spirometer. It is more sensitive than spirometer in picking up airway obstruction. So when your airways get narrowed, they are obstructed. When the defect is not very bad, your oscillometry will pick it up, but your spirometer cannot pick it up. Similarly, for small airways, which are usually missed on spirometer, your oscillometer can pick it up. So these advanced lung function testings like the body box, the DLCO and the oscillometry, they can pick up early COPD and they can guide you to a better preventive aspect, and they can help us in taking decisions faster and earlier. The second advantage of these advanced lung function testing or body box, DLC and oscillometry also is to identify mixed defects. Sometimes a person who's smoking can have two diseases together. They can have a COPD, they can have an ILD together. So when such mixed defects happen, a spirometer will show normal results despite the disease being there. So again, in such conditions, tests like DLCO can help us in picking up these abnormalities better. So in several ways, these advanced lung function testings will give us an edge over the conventional spirometer. But lung function testing is essential for everybody with lung symptoms, for diagnosis, for prognosis and for therapy. So everybody has to ask for lung function testing and get the lung function testing done. Spirometer is the basis of lung function testing, but there are a lot of tests beyond spirometer which can be done, which will give even better insights into how your lung is working. Thank you so much.